Hello and welcome to the Alabama Public Health Training Network. Thanks for joining us today for today's program, County Health Department State Purchase Vaccine Review. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and the email are on your screen now and will appear later in the program. Also, the handouts are available online. You will need to register for this program in order to access that material. I'm Cindy Lessinger, Director of the Immunization Division at the Alabama Department of Public Health, and today we will review all aspects of state purchase vaccine process. ADPH staff will also be available to answer questions, ensuring that local staff understand the process. So let's get started. I do want to mention before we get started our panel here of ADPH staff that has been helping us along the way. I have Denise Strickland at Immunization, Nancy Bishop with Pharmacy. I have Belinda Hensley with Revenue Cycle Management. I have Betty Helms with Immunization Division. I have Jeannie Kennedy from Finance, and I have Valerie Cochran from the Nursing Division. So hopefully with all of that panel and myself that we can answer your questions, and if not, we'll take your questions and get back to you with them. So let's get started with the program today. The objective for today's presentation is going to be to describe the process of moving the state purchase vaccine to the county health departments. And then we're going to review the documents in the library to make sure you know where to find your references. So the first question probably everybody has is, how did we get here? Why are we purchasing now the vaccine at the county health department? I want to give you just a brief overview of that. From 2010 to 2016, the county health department's administered vaccines have now gone down 49%. And I know it may be kind of small on here, but in your handouts you'll see what the statewide vaccine that's been administered is and how much the county health departments have done during this period of time. And you can see from the graph that the county health departments have gone down from 2010 to 16, and we are this past calendar year, we only gave 134,000 doses in the county health department. And there's a whole variety of reasons for that, and no one is saying what those specific reasons are because every county is different. But we have seen overall that the county health departments are actually given less vaccine overall year per year. Another reason why we got here was that the state vaccine that we have been purchasing since 2012 and pushing out to the counties, unfortunately, there's been at least $300,000 worth of wasted vaccine because not knowing what the demand is out in the county, that never was in sync with what we were pushing out. And so we've tried other programs also. We've tried the Adult Hepatitis B Initiative. We've tried 317 program, and the state purchase vaccine was another one of them, but it just wasn't working from a state level out to the county. And so everything that we've been trying is not working. And so we really needed just to get down to the nuts and bolts and try to eliminate the middleman for getting you the vaccine that you need for your community. And we want to help you with that. So it's now time to move the vaccine ordering to the county health departments, and that will allow each county health department to do what they need to do, meet the demand of your community, and then increase it later. If you can find a niche or a market in your community, then you can expand that based on this new program. So how will this benefit the county health departments? First and foremost, you will receive all the reimbursement for the vaccine. So all the county health departments have been traditionally receiving the vaccine for children admin fee, which is $8, and that's for all vaccine given to Medicaid, underinsured, and American Indians 0 to 18. When we had the adult programs, you were not able to bill for those, and that was no gain to you guys at all. But we started this state billing project with state purchased money, and we started that in 2013 or 2012 and going through this past year in 2016. But we will give you a summary of what we received or what the results were so we know that you can actually make money from the state purchase vaccine. So we collected during 2013 to 2015, we collected $2.4 million in Blue Cross 0 to 18 years of age vaccines. We administered $1.2 million worth in the cost of the vaccine, and then we gained 1.2, and that's the 1.2 that we're actually pushing back out to the county health departments. And we'll talk a little bit more about the funding here in just a minute. Again, you can tailor this program to your current demands, and I understand from the realignment planning that's currently going on, that's what every county health department is supposed to be doing. And then you can, when the opportunity arises, to increase the need if necessary, specifically maybe even in the adult population, and we'll talk a little bit more about that in just a second. Is the move financially supported? And it is. So actually we're going to give every county health department, and it has already been requested that it be put into their accounts, the money it took that we purchased for them that they administered from July of 15 to July of 16. So that money has already been put in the county health department's accounts, and that's the $1.2 million. We've also requested that $125,000 or $1.1 million go to the areas. So each area got $125,000 to support the program, whether it's staff, it should be going for staffing. It could be nurse, it could be clerical, it could be whatever you guys need to order, to inventory, for EOPs. You know, it's really up to the areas to decide how their $125,000 was going to be utilized for immunization. Okay? And then each county has to set up their own account and begin ordering. So the Amerisource account, there may be questions. I think that is, I saw Nancy, and most of that has already been set up to have, so they don't need a fifth account. And we can talk a little bit more about that in the future, here in just a few minutes if you have questions for that. Okay? So it's, you're already have an Amerisource account that you're purchasing oral contraceptions for. So you're already ordering supplies. So it's going to be in a similar vein that you do the same thing. You can also purchase from the manufacturers, and we can talk a little bit more about that here in just a minute. So why did we also decide here at the central office to close the vaccine distribution center? And the main reason, like everything that we're talking about right now is trying to save state money. We were using state money for staff, equipment, shipping, supplies, maintenance, and of course the wasted vaccine that I showed you earlier. And that wasn't all of it, that was just for those 2 years. So we needed to make sure that we were as efficient as possible with state money. And I think cutting out the middleman, us, is going to be the most efficient way for our state and saving that state money. All right, so before we leave the vaccine distribution center altogether, this is the vaccine that we currently have at the VDC. Again, we're not purchasing any more vaccine, but this is what has not been requested from the county health department. So this inventory is still available. If you are interested in these 3 vaccines, please email. You see the email address there at the bottom with the amount, and we will ship that to you because this is all we have and that's all we're going to have. And it can be used for international travel clinics as well. I think that's where most of that adult hepatitis B may be used. Okay, so the other question has come up, you know, what does the immunization field staff do? If they're not going to be helping us in the clinic, giving shots, doing inventory, doing ordering, what is it they do? Well, let me tell you a little bit about immunization, that the division is 97% or more, it's actually a little bit more, federally funded. So CDC gives us the money to run our federal program. And what our field staff is supposed to be doing is to comply with those federally required activities. The main one, the biggest one, is vaccine for children. So we have to, Denise Strickland is over the Vaccine for Children program. We have to process all the orders that go out to the field for 535 providers approximately. And then our field staff has to go to each of those providers and make sure that they're following that federal requirement. County health departments are VFC providers out of that 535 that we visit. So that's a big part of their job. They also have to do AFIX, which is an assessment to make sure that they're using the vaccine properly and to see what their vaccine coverage rate is and to give them education and consultation. The biggest thing that our immunization staff has been doing in the last year has been Imprint, which is the registry, provider and vendor education. We have exponentially grown with the registry, and they have to go and train all of those providers and all of the users of Imprint, which include the doctor's office, pharmacists, now public schools. We're about to embark on private schools and daycares. So that market for us is really just beginning. And the other exceptionally important task that our immunization field staff does is those vaccine preventable disease investigations and outbreaks. Every time a notifiable disease is reported, our staff has to do that investigation. If there's an outbreak, they have to do that. So it could be in a daycare, a school, or a hospital. In addition, they have to try to collect specimens. If we can't get a provider who's interested in collecting specimens, they have to go and follow up with that and get specimens. And of course, they have to do community education. So the immunization field staff has more activities that are going to continue to grow based on the federal grant, and that's what they should be doing and will be doing. Okay, so let's talk about what the county health department should be doing. Each of the county health departments should by this time should have an account either with Amerisource or one or more of the vaccine manufacturers. It could be with, and you can have it with all of them. There's no reason you can't. It's just a matter of time setting up the accounts and making sure you're ready to order. One question I had about, is it going to cost the county health departments more if they order it as opposed to us? And the answer is no. It actually has to be, by the Attorney General's opinion here in Alabama, it has to be exactly the same amount. It's called the Minnesota Multi-State Pharmaceutical Alliance. I think I got some of that right. But everybody has to order. When they order, we'll get exactly the same price. It doesn't have to go through bid, but it's the exact same price that we were paying. And then you pay the invoices coming in, and I did put a caveat on this one. We do have legislation has given us an earmark of $150,000 each year in the budget, and that is for adult hepatitis A and hepatitis B. We are working with finance to, on a first-come, first-served basis, if your county orders adult Hep A or adult Hep B, that will be paid, that invoice will be paid with that $150,000. We're still working through the details of how that will actually be done. So we will try to help you with adult Hep A and Hep B. Of course, you guys give the vaccine. You guys need to, of course, enter the information into Falcon and then check the EOPs. And we're not going to go a lot through the EOPs, but I think we do need in the future, I'm looking at Belinda as I'm saying this, that we probably need to do a EOP training, and I'll be happy to participate in that with her to make sure everybody understands that checking EOPs isn't just checking rejections. And that's what I think a lot of people have in their mind when talking about the explanation of benefits from the insurance company, the EOPs. All right, so let me give you an example of how the county health department can make money. This is based on a 2-month-old infant visit. If they get all the vaccine that the ACIP, or the Advisory Committee on Immunization Practices, recommends, they should get TDAP, Hib, pneumococcal, Hep B, polio, and rotavirus. In the VFC example, we're sending that to you free through the federal entitlement program. You don't get any vaccine cost reimbursement, but you do get an admin of $8. So you will make a total of $48 for that child. If you see a Blue Cross child, and Blue Cross includes CHIP, so CHIP is Blue Cross. So if they got the same vaccines with Blue Cross, the cost would be the Minnesota multi-state contract price right now, and then what Blue Cross would reimburse is the next column. The admin is added to that, so the total reimbursement for a Blue Cross trial is $498. So you will make $154 for every 2-year-old visit that you do, compared to $48. So I know that it's going to be hard to recruit Blue Cross Blue Shield children, but those that are coming in and are billed, you will make money off of those children. Okay? And the same thing with adult. We'll talk about that here in just a second. So where to find out more information? So we have put all of our documents related to state-funded vaccine in the document library under state-funded vaccine. And in that folder, you will find the documents of frequently asked questions, the funding that I mentioned earlier by county health department as well as public health area, the vaccine encounter forms. We want to make sure those are up to date and that we're updating our billing unit with that. The new eFix features, where you can see the explanation of benefit or the EOPs for Blue Cross. You can see the letter that was sent out back in October to the health officers and the area administrators. The PowerPoint that was completed back in September, so this is the second satellite broadcast regarding the state purchase vaccine. It also talks about the vaccines that your county administered during that July 15 to July 16, so that's also there available for you. The information about the Amerisource and all of the vaccine manufacturer accounts. And it also talks about expired and spoiled, and I know that's a big question everybody has, and we'll address that in just a minute. And then the MCAP pricing is the last document, but we did add one just before we came on air, and that is the Blue Cross reimbursement rate. One of the administrators had asked me about that, so that's now out there in the document library. Okay, so let's talk a little bit about billing and the fee bill, because I know that's been a big issue. So for children who are Medicaid or Blue Cross, nothing actually changes at all. The only difference is you're buying the vaccine and you're administering the vaccine. So the billing will go through Falcon, and it's going to be completed just like it always has, so there's no change there. For adults, that will soon be back on both Medicaid and Blue Cross, and they will go back to October 1st of 2016. Belinda Hensley's working diligently on that, making sure that the rates have been submitted to Medicaid and Blue Cross so that we can start the billing and go back to 10/1. And then, so this has been the biggest issue is for if you have a fee bill. If the patient has insurance, then you bill the insurance and then the patient doesn't pay. If the patient has no insurance and you have a fee bill, then you need to collect whatever the fee bill is for those counties. If you're one of the 13 counties that has no fee bill, the only difference is you can't collect anything from the patient. If they have insurance, you will that will be billed. The Medicaid and Blue Cross will be billed. So I hope, and if you have questions about that, please call in and we'll try to discuss that a little bit more, but that really isn't real. It's not different than what you're currently doing. If they have Medicaid and Blue Cross bill, you don't collect from the patient. In a no-fee county, you cannot collect anything from the patient. So I think there's a concern about that, and we can talk more about that as you call in. All right, let's talk a little bit about wasted and expired vaccine. So anything that we've sent out to you prior to 10/1 has to come back to the warehouse, and we will turn in that vaccine back to the manufacturer. Anything after 10/1/16 that you have purchased, you'll follow those manufacturer instructions. So if you bought it from Amerisource, you need to follow Amerisource instructions. If you purchased it from Sanofi, you follow their instructions, and so forth. If it's VFC vaccine, we want to make sure that doesn't get lost in the mix. That still goes back to McKesson through Vtrix or Vtrax, depending on how you pronounce it. So the vaccine, again, before 10/1, send it to us and we'll return it. Anything after 10/1/16, you guys will make the return. So I just want to remind everybody, when you place an order, it doesn't have to be for a month or 3 months. I mean, you can place an order for what you feel comfortable with so that you don't have any that expire, and then you really avoid most of this unless a refrigerator goes out. The only time you have to worry about expired is if you over-order, and then you have a lot sitting around. So our staff has been instructed that if they have to go pick up VFC vaccine from a provider's office who closes, that they can't bring it back to the county and just put it in your inventory without permission. You have to grant them permission for them to bring it to you, because you would be then responsible for it, and we don't want to get in this position where you have to return a lot of vaccine. Okay, so what other things that immunization recommends is that every county health department collect all the insurance information, and I'm not talking just Medicaid, we're saying all insurance information, because all Medicaid, Blue Cross, Medicare, TRICARE, whatever it is, we really need to be collecting all the insurance information, because we need to figure out the next insurance company that we may be able to start billing with. But right now, most of them are blank, about half of them are blank. So that's kind of hindering us going forward on the billing. We do ask that, we do recommend that the counties look at the exclamation of payment or the EOPs to make sure that you are getting paid for each vaccine that you've been given, but also every antigen in those vaccines. And that's really the biggest check that when you're looking at the EOPs, did you get paid? And if you didn't, why? And the second one is, did I get paid for every single antigen? And Betty Helms went over that quite well back in September on the satellite broadcast. And if you do find any problem, Belinda Hensley and her staff in Revenue Cycle Management will be happy to help and resubmit those claims. You know, she's looking at it from a pattern to see if there's a pattern of things that are not paying, but she can't look without you notifying her about individual people that need to be resubmitted, if that makes sense. So she was able to find a pattern where a vaccine should have been coded as a TD instead of a typhoid. So she noticed that didn't make sense, so she went and looked at it, and so she's fixing those kind of things. But she does need your help on identifying individuals who need to be resubmitted. And the other big thing right now everybody should be looking at is pre-booking your flu vaccine. So whether it's through Amerisource or through the manufacturers, whatever, and I can place that. I don't think we have that out there right now. The number of flu doses that you ordered last year, we can put that out on the document library so you would have an idea of what you ordered through us last year. But it is time for you to go ahead and pre-book those flu orders for this coming flu season in the fall of 2017 and 18. The VFC you should also have pre-booked as well. So you're going to have 2 flu orders, 1 VFC and 1 state purchase. The state purchase is the ones that you do the drive-through clinics with, so you can decide now how big or small you want your flu clinics, your drive-through clinics to be now when you place your order. Let me go back to the flu real quick, and this is not on the slide, and I hadn't planned on saying this, but there is still flu vaccine right now. If you need flu vaccine because you want to hold a clinic today, you can give it to the general public, and the vaccine is still available. So you can purchase this year's flu vaccine today if you want to hold a flu clinic in the next couple of weeks. It's still not too late. It takes 2 weeks for the vaccine to build an immunity. We still haven't, we're getting pretty close to a peak probably, but it's not too late to get your flu vaccine or to hold flu clinics. All righty. Anything else? We recommend, you know, things are going to be changing in the clinic, and so these are just general recommendations. These are not requirements, but, you know, we ask that you do educate everybody that comes through the county health department. Regardless of the service, there's a vaccine forecaster and Imprint that will tell the patient everything that they need. And actually, you would print out the patient card or parent record, and it does have the same vaccine forecast feature where it tells you in the future all the vaccines that are needed, not just for the next visit. So that's something that you can offer to everyone. And if you guys don't offer the vaccine, you can, and we recommend that you do to all ages, but if not, to make sure that you have a provider locally that you feel comfortable referring those patients to if they don't have a medical home. We ask that you do walk-in clinics if at all possible, especially back to school. That's really going to be the main time that county health departments need to consider walk-in clinics. And then we'll talk a little bit about if you guys have an outbreak or you have vaccine preventable disease in your counties, that immunization is actually going to replace the vaccine. We ask that you go ahead and give, if it's recommended for anybody who's in contact with a vaccine preventable disease and part of an investigation or an outbreak, that they come to the county and receive the vaccine that they need, and we will replace it with other federal funds. So we will put that in the clinic protocol manual for April so that everybody knows that we're not asking you to pay anything out of your accounts for vaccine preventable disease investigation outbreaks. Immunization will replace that vaccine, and we'll place an order with the feds, and it will be drop shipped directly to that county health department.
Do they charge for outbreak vaccine?
No, well, that's a good question. Valerie asked, can you charge for outbreak vaccine? If they have Blue Cross or Medicaid, yes, I think you need to charge. Just like you and I, if we're in an outbreak or an investigation, we have insurance, we get vaccine or we get a prophylaxis, our insurance is going to be charged. So yes, if they have it, yes. If not, no. We would not charge, even in a fee county, because it's outbreak related. Because we want to make sure there are no hindrances to the the mitigation of an outbreak? That's a good question. Okay, so who do you need to contact? So Denise, of course, is in immunization for encounter forms, and then 317 replacement vaccine that we just discussed. Falcon, of course, Alan is still available. Jeannie Kennedy's here about finance POs and invoices. There was a mistake. I made the mistake on the handouts that you have currently. Billing, revenue, cycle management, and eFix all are Belinda Hensley. I'd spread it out through several people. Now it's all Belinda. Go Belinda. If you have any questions about those. And then about ordering, of course, Nancy Bishop is the contact for Amerisource, but the other manufacturers, they all have their own representatives, and they are more than happy to help you in any way possible. So I know that GSK is working on making sure everybody has a direct account with them. They're not required. It's not required that you have a direct account with any of the manufacturers. They're just a good option to have in case Amerisource is behind or delayed. But Amerisource is really the one that you need to have, and if you have any problems, then you would go to the manufacturers. But it's really going to be up to each county health department to decide how they're going to implement the program and how they're going to expand it in the future. I think that's all I have right now. So I wanted to run through that and really open it up for questions, because I know we have a lot of questions out there that we need to get answered. So I'd like to start with any email questions at this time. So we'll wait a few minutes, because everybody probably thought I was going to talk a little longer than that. But there is a lot of reference material that's already been put out, and we want to answer those specific questions that I understand some people have. So anybody in the audience have any questions? Okay, well, we'll just wait a few more minutes and see, and if not, then we could wrap up early here today, and that would be great. And all right, there is a caller from Watauga County. Go ahead.
Hello. I was calling because I was wondering about when I order through Amerisource, a lot of times they're saying it's drop shipped and it's non-returnable. And it's because nothing else is available, and it seems to be quite a few of them. What's the difference between the drop ship? Do you know? I mean, is it something we should avoid?
Drop ship to me means, and Nancy's going to get the microphone and follow up, drop ship means they're going to send it directly from the manufacturer to your door.
And it is non-returnable.
And it is non-return. Yeah, vaccines, I've never heard of vaccine being returnable, so I'm surprised that that's in.
Yes, a drop ship just means that Amerisource does not stock it in their distribution center. It's being shipped directly from the manufacturer to your county.
And there's not a difference in the price, because it seems to be a considerable amount of them that are that way.
Is it an MCAP covered in product?
I do not know the answer to that one.
Okay. All of the vaccines are MCAP. So you should be getting the price that's in your MCAP catalog when you go online. If you're not, if you will send me the product, I will forward it to MCAP to find out why you're not getting their price.
Okay. Thank you so much.
Thank you, Watauga County. Do we have any other callers at this time?
I can talk about the...
Please. I'm sorry, I was taking notes. Nancy, please, yes.
One of the things that we're working on with Amerisource is creating that fifth account just became very, very difficult, and we kind of gave up on it as an option. So Amerisource has agreed to separate all your products on invoices. So just as you have a PO for your family planning products, you would get a PO for your immunization, all your vaccines, and they will come on one invoice. And so you can code that to the appropriate fund code from that invoice. So in the future, when this is set up, and it should be very soon, all the invoices will be separated, and you won't have just one invoice that has everything on it. Each product line will be on a separate invoice.
All right, thank you, Nancy. Any questions coming in?
So are we wanting each county to get a separate PO just for vaccine?
There's, you want to go ahead and finish up the question? So Jeannie's asking the question,
The question was, because all of our counties have an open-ended purchase order through Amerisource, where they buy all their medical supplies. And if we are wanting them to have a separate PO just for vaccine, that is going to require each county to send us a requisition just for vaccine. They can estimate their annual usage, their annual amount that they expect to order, just like we ask them to on their medical supplies. Mm-hmm. We can start them at a base amount, and as the year progresses, if they need more, we can add more. But if we want a separate PO, we're going to need separate requisitions.
okay, so how's that going to affect what you...
Can I hear Jeannie?
Yeah, can you guys hear Jeannie, Ryan? Okay, yes.
Okay. We have to do it this way because it was my understanding that when a county ordered medications from Amerisource, it all was put on one invoice. And so if you have your 340B medicines on there, those can't be mixed with a vaccine since they're coming out of two different funds. So I was told the only way to do that, and I was told this by county people, is to have it on separate invoices. So one PO, I'll leave it up to finance on how they want to work the POs, but you're definitely going to have to keep your funding separate on these.
Right.
We can do a separate funding line just for immunization using the same purchase order.
Okay, and
whichever is easier, we'll facilitate.
And that's if finance can do that, that would be great. They wouldn't have to do that separate requisition.
So we just need to know what those funding sources are and how much they want us to start on that initial funding line, and we can go in and add it.
Do you need that by county?
Yes.
Okay.
Okay. Thank you,
So
guys.
each county will have to get that to Jenny?
Yes, each county will have to estimate the amount of vaccine they think they're going to use for a year as the base.
Correct.
Okay, what if they go over? Is that a problem?
We can just add funds as necessary.
So either way, if they overestimate or underestimate, we just need a reasonable estimate.
Correct.
Okay. All right, we have a phone call from Elmore County.
Yes, my question is, I was one of the counties who received a private doctor's BFC vaccine for flu.
Right.
We have not touched it, but I'm now responsible for it, and I was wondering, do I just pack it up separately and send it back to the warehouse when it's time, or what? It makes me nervous to be accountable for another person's vaccine.
Denise?
That would be VFC vaccine, wouldn't it?
Yeah.
Yeah, it is, but
Okay.
I thought while I had you, I would ask.
Yeah, it needs to go back to McKesson, just like you would send your regular VFC vaccine back to them. So when it expires, try to use it if you can. Try to use
Well,
it.
I can't use what I've got.
Yeah.
And this was like 100 doses from a doctor in Prattville because Autauga couldn't take it, and so they brought it to me.
Okay. Just wait till it expires, because you can't send it back before it expires, and then just send it back just as you would do with any other VFC vaccine, back to McKesson.
All right, so if I ever again happen to get a private doctor's VFC vaccine, I cannot return it until it expires.
Yes, ma'am, that's correct.
That's correct. So we are working
Okay.
with our field staff because we understand that that is an issue and we don't want to put you in that position. So our field staff is going to try to identify other VFC providers who can actually use the vaccine and not just send it back to the county health department as their default.
Yeah, okay.
Totally
Thank you
understand.
so much.
Right. All right, got an email question, Denise?
Email question, asking, I still have some expired state vaccine purchased before October 1 of 2016. What address do I return it to? It would be 1635 Mitchell Young Road, Montgomery, Alabama, and make sure you address it to Siobhan Tyner in immunization. Otherwise, some of the stuff that's coming back is getting mixed in with other divisions stuff. So we're trying to keep it all coming back to the immunization division.
Yeah, when you return it back to the warehouse, that's not a new location. It's the same place you've been sending expired state-funded vaccine. So that's not new. We just need to make sure it gets into the immunization room. If you'll
We just don't have the labels anymore
correct.
to send out. So
Okay. We have a call from Hale County. Go ahead, Hale County. Hello, caller from Hale County.
Hi.
Hey.
I think I missed the first couple of minutes of the presentation.
Yes, ma'am.
And the vaccine that's left at the distribution center.
Yes.
I see there's hepatitis B for adults. Is that 317?
No, ma'am.
And can we use that?
Yes, ma'am.
Can we get some of that?
Absolutely. So the email address, so the handouts are out there on the website. You would just email to immunization@adph.state.al.us. That's on that slide, and request that. No, that was state purchase vaccine that you can bill for and or charge the patient for, depending on if it's an international travel clinic. But if a person has insurance, Blue Cross, it can be billed. If they have Medicaid, it can be billed. Does that answer your question? Yeah, so that vaccine available that was on that slide is available at this moment.
All right, thank you.
Thank you. All right, we got a call from Sumter County.
Yes, I was calling about the pre-ordering the flu vaccine
Yes, ma'am.
through Amerisource. What guidelines are there? I haven't seen any how to go about doing that. Could you send that out or tell me how to do that?
I think that you actually work through MCAP in doing that, but I will have to get the exact instructions.
Okay, so
They
we'll,
need to talk to their area nursing director.
okay, area nursing directors would know how to help you pre-book that flu vaccine.
Area directing nursing?
Area nursing directors, I'm sorry, I didn't mean to say that. Oh, okay.
Okay.
So the area nursing directors have the instructions on how to pre-book the flu in Amerisource. And we'll get that and put it out on the...
And I think they have the numbers, which is the main thing. They need to know how much to order. And so I would work with the area nursing director instead of willy-nilly going out there and ordering the vaccine.
Right, and so, yeah, that's a great point, Valerie, that you need to work with your area nursing directors to determine how much you need. So, for example, you heard one of the counties say they have vaccine they can't use right now, so we really need to be more mindful about how much you're going to order. So the pre-book is basically trying to reserve that you have at least a minimum amount of this flu vaccine for next flu season. But next year, like now, you probably can buy more, but it just will depend on the season and the market. So what is the minimum amount of flu vaccine that you want to have next fall is what you need to order today, not the dream or we're going to have a huge flu season, because we don't know. So you just need to make sure you have some reserved for the fall.
Okay, thank you.
Thank you.
and make sure you order your VFC flu vaccine. Pre-book your VFC flu vaccine. Hopefully by next Wednesday, because I think I put the cutoff as the 31st. Get that into Siobhan. It was in an email. If you need that email sent back out, let me know. I sent it to all the contacts that we had from the county health departments when we go in and do VFC site visits. So if somebody needs to be changed, added to that list, please let me know. By the way, this is Denise.
Well, and also I wanted to mention, someone said they think they might have missed the first couple of slides, just to let you know that this program is being recorded and will be available on demand. So make sure other staff that was off this afternoon or not available can go back and see this once it's posted online. We have a caller from Watauga County. Go ahead.
Hi, you said that there's going to be a training for the EOP, for checking the EOP. Do we know when that training is going to be?
No, and I should have probably not said anything. I was looking, me and Belinda have been talking about that.
Mm-hmm.
but it has not been scheduled or thoroughly vetted out yet, so
Okay.
there is no scheduled EOP training.
No scheduled. Okay, and I had another question because
Yes.
I had asked some of our Medicaid workers. So Medicaid is going to start paying for adult immunizations?
Yes.
Okay, what about if they only have Plan First? Is Plan First going to pay for it as well?
If they are, I'm going to let Belinda, because there has been one glitch with HPV, but it was not a policy glitch. I think it was a billing on Medicaid side, and they have to correct it on their side so we can rebill. So
Okay.
as far as we know, all vaccines that are available are recommended for adults. If they have Plan First, they can get those ACIP recommended vaccines, and Medicaid will pay for them.
Okay.
They can't carve those out of that policy.
Okay, so right now, anybody that we're giving vaccines to, we don't need to bill them unless they have no insurance. Because unless they don't have Medicaid Plan First or Blue Cross Blue Shield. Because we're going to go back and bill those, right?
Right. If you have a fee bill,
We do.
okay, so yeah, you can charge the patient if they don't have Medicaid or Blue Cross, and part of Medicaid is the patient first. If they don't have that, you can charge the patient your county fee bill.
Okay, great. Thank you.
You're welcome. Any other callers? Any email questions? Do we have any questions in the audience?
I would like to go
Or
back
comments?
and touch on the addition to the current Amerisource POs.
Okay.
Each county will need to send us a new requisition, and if they would, give us the current Amerisource purchase order number that they have in their county, and state on there that this would be an additional line to cover immunization with that correct funding. When the invoices arrive and you do your material receipt, please make sure your material receipt shows the immunization funding. I'll go over my staff so that we're very conscious of what the invoice has on it,
Okay.
so that if we see it's vaccine, that we charge it correctly.
Okay.
But if the counties will material receipt it with the correct funding on there, it would eliminate a lot of errors on our end.
Okay. Well, that'd be great. And so what we'll do is we'll document those steps and put that on the document library in the same state fund vaccine
Okay.
folder. Okay, so we will hopefully do that here by the first of next week, so we want to make sure you get that information. Thank you. Any questions coming in? Does anyone have any comments or suggestions that we want to give to the counties? Well, I'm going to go ahead and start wrapping up if no one calls now. There is another caller coming in. Hold one moment, please. There is a caller from Geneva County. Go ahead, Geneva County. Geneva County. Hello? Caller?
Hi, I just wanted to clarify something. Did I understand y'all to say hello?
Yes, hello.
Hello?
Hi.
I just wanted to clarify. I understood that someone said that Plan First would pay for adult vaccines.
I think we're talking about patient first. That's what we weren't talking about plan first. We were talking about patient first.
Yeah, because Plan First is family planning, and I don't think Plan First, I didn't know that they would pay for anything other than birth control.
I think they do pay for the item, but I don't want to talk about family planning because I'm not familiar with that. So we were talking about patient first. We weren't talking about family planning. So I'm sorry, did that clear that up? Okay, any other questions coming in? No calls? Any email calls? Email questions? Okay, well, going once, Going twice. I do want to thank everybody for attending this staff training. Again, we have Denise Strickland, Nancy Bishop, Belinda Hensley, Betty Helms, Janine Kennedy, Valerie Cochran, Dr. Mack, and Jamie Durham is here, as well as other immunization staff, and I really appreciate your time and attention. I think that if you work through the details, that this program can offer you revenue that you didn't have before. And I think that's going to be real important, but you, of course, I know you have to be mindful about everything else that you're doing in the county health department, and I appreciate you tuning in to find out more about how to utilize the state-funded vaccine that's being offered. Y'all have a great day. Thank you very much.